hospitals lose money in claims simply because they fail to understand the claims blueprint. So the claims blueprint is a generalized process flow wherein hospitals can determine which area of the process flow is working or is not working. So everything starts with patient registration. So the patient registration is where patients, okay, demographics and information are entered into the hospital system. So in our setup, patient registration, okay, is simply known as the admitting office. In the admitting office, you have the admitting staff. Now, the moment, okay, patients are given clinical services, be it in the emergency room, be it in outpatient department, you bring them to the room, ICU, CCU, OR, or DR, that is now the next level, which is the delivery of services wherein clinicians come in to provide services. So you have here the doctors, nurses, the laboratory people, the diagnostics people. This is also included are the pharmacy. Okay. Now, once services are given, information, okay, and supplies as well as services are then transcribed into what we call the clinical chart. So in the delivery of services, information is gathered, transcribed in a specific document. Also, in the delivery of services, charges are captured. These are supplies and services, okay, that involves financial information. So when charges are captured, okay, same information is then added or inserted into the clinical chart. So to proceed, okay, once the doctor discharges the patient or gives the MGH order, two things will happen. From the delivery of services, okay, part of the document of the clinical chart will either go to the medical records, okay, wherein the final diagnosis is converted into an ICD-10 code, and then this proceeds to the billing office. Now, another path is from the delivery of services, MGH order is given, okay, the face sheet or the part of the document, okay, goes directly to the billing, wherein the billing people has their own ICD coder. So still, the final diagnosis is transcribed or converted into an ICD code. So either way, okay, the goal is from delivery of services, it passes to the medical records, then proceeds to the billing office. So in the medical records, of course, you have your medical record staff, okay? For the billing office, and definitely you have the billers. So once the patient, okay, pays the out-of-pocket, okay, the patient can easily go out of the hospital. Patient is physically out. Now, from the billing office, that document, okay, goes back to the delivery of services. Okay? So it then goes to the medical records, okay, and completion of the clinical chart is done by the medical record staff. Now, somewhere in between, depending on the hospital, the claim form 4 encoding happens. Okay? So naturally, you have hospital staff or you have the clinicians to transcribe information into the claim form 4. Now, gathering all of those things, including the billing documents, okay, the documents are collated in the claims office. So naturally, in the claims office, you have your claims processors. So the claims processors will just collate, okay, the non-clinical information, the financial information, and the clinical information. So in the claims office, okay, several forms will be generated. You will have your CSF for the non-clinical information. You will have your CF2, you will have your CF3, and the CF4. So, together with the clinical chart and the laboratory procedures, or laboratory results rather. Now, after collating, and the claims people will validate the information, okay, collated in the billings office. So the claim is then generated. After that, okay, it is transmitted to PhilHealth via the e-claims. So depending on the hospital, the e-claims people, okay, may either be an individual or a team. They could belong to the claims office or they could have a different office. So it depends on the facility. But nevertheless, I would want to stress that the claims office plays a critical role in the generation of revenue. Now, from the claims office or rather from the e-claims transmitted to PhilHealth, once PhilHealth receives the claim, PhilHealth will then process the claim, and PhilHealth, if by any chance your claims will be paid, okay, they will pay you through auto credit payment system. So once payment is in, the next step is hospitals need to post the payment. Okay? So in posting payment, it is very critical that certain people should do it. So from posting of payment, in the event some of the claims are not paid or some of the claims were denied, the next level should come in. You have the RTH denied management. So, and it completes the cycle. So as you can see, the claims blueprint is very critical. Each step of the claims blueprint has a specific office or has a specific people or a specific number of staff. Hospitals fail in claims processing simply because the claims blueprint, okay, is inefficient. Now, why is it inefficient? Out of several hospitals, I have seen hospitals wherein the claims blueprint is there, however, nobody is on top of the claims blueprint. Nobody monitors the entire process flow. Nobody monitors patient registration. Nobody monitors the delivery of services. Nobody validates, okay, the medical records. Nobody reviews or nobody guides people in the CF4 encoding. Billing and claims have their own thing, and e-claims have their own thing. Okay? And it continues. So the moment your claims blueprint is disorganized, expect your claims will not be paid. Okay? Hospitals need to be efficient in managing claims. The moment, okay, you have efficiency in the entire claims blueprint, your claims will be paid. One thing to note, the claims blueprint, if you can observe, it may involve at least or more than 50%, okay, of the employees of the hospital. So that is very critical. Okay? So, call to action is this. Okay? First, you need to have someone, okay, who will manage the claims blueprint. Okay? Next, you need to invest on training. Okay? If you want your claims to be paid, you need to invest on training your staff. So the question is, who are the staff that I'm referring to? It's the entire claims blueprint. The moment you train your staff, it creates efficiency. From there, you need to monitor it. This is Coach Doc Ben. See you in our next session.